Welcome to Pharmative Live. I'm Dr. James Partyka. I'm your host, and this is Pharmative Live, coming to you live from Palm Springs, California. Pharmative.com, our social media environment website, and Pharmative Live is all about connecting patients to healthcare professionals and scientists such as myself in order for us to educate ourselves so that we can make informed decisions about our healthcare, your loved one's healthcare, your family's healthcare. And that's Pharmative.com, and that's Pharmative Live. Again, it's all about providing to you clear, concise, factual information that matters to your healthcare. That's Pharmative.com, and this is Pharmative Live, and our topic today, and shout out there to Helen and Jimmy out there, who's on the East Coast right now, and a number of friends out there as well, I see. This is Pharmative Live, and the topic today in our 10 to 15 minute forum is Maskless. Oh my God, what do I do now? But before we begin our forum today for Pharmative Live, I just want to say first that we're sponsored by our PNN.1 Plus Health mobile app today, and you can download your app at your Apple and Android stores for free. Not only does the PNN.1 Plus Health mobile app have great music with Pride Nation Radio, we also have a number of other streaming music stations, classical music, hip-hop, jazz, Latino music. But we also have a number of vital healthcare resource tools, such as a virtual pharmacy, where you can look up the dosage and side effects of your medications with a drug interaction checker. We also have a doctor symptom checker, which is the best bot in the world, which will come up with a differential diagnosis based upon you and your symptoms, which you can discuss with your healthcare team, and a number of other vital resource tools from reliable sources such as the CDC and the FDA. So when we talk about healthcare, I just want to make sure that we're all on the same page. Make sure you're getting your information from reliable sources. So for example, with regards to medications, it's the FDA, and you can go to drugs.com and get all the information about drugs that are approved in the United States, or the Centers for Disease Control, or the National Institutes of Health, or the National Cancer Institute. If you're looking for general information from the networks, ABC, CBS, PBS, NBC, all the major networks generally provide reliable, factual information based upon reliable sources. When we're talking about cable information about healthcare, my two favorites are CNN and MSNBC. I feel like they provide the best factual information. Be careful with what you discover on the internet, especially regarding a pandemic like COVID-19. There's a lot of misinformation about the vaccines and about the epidemic, and you've got to basically gauge whether this is factual or not factual information. The best way you can do that is by going to reliable newspapers in print, newspapers online, our television networks, as well as Pharmative and Pharmative.com. So that's my announcement today. I have a second announcement as well. In the fall, PNN Media Group, our sister company, is launching a new chat show called Pride Nation Radio Speaks Out. It will premiere on September 5th. Right now it's in development, and we're actually working on our new set. And we're going to talk about current events, some politics. We're going to have special guests that will pop in and pop out either through Zoom or through WebEx or Skype, or actually live on our studio set. So put a note on your calendar for January 5th. That'll premiere at 11 a.m. Pacific Coast time. We're looking forward to it. We're hoping to have a lot of fun. The great thing about living in Palm Springs, we're about 2 hours outside of Los Angeles. There's a lot of wonderful creative people, artists and writers, people that have been in the entertainment business and so forth. And so there's a lot of richness with regards to what's happening in Palm Springs, what's happening in the Coachella Valley. There are art festivals, film festivals, comedy festivals, and there's a lot of people coming and going from Los Angeles. So it's a great place to have a live podcast chat show called Pride Nation Radio Speaks Out. So put that on your calendar, September 5th at 11 a.m. Pacific Coast time. And now Pharmative Live now has this new time slot of 9 a.m. Pacific Coast time. As we move forward, we'll continue to, we'll take a little bit of a hiatus. We're actually kind of finishing up season 3. And then later on in the year, we'll start up with season 4, Pharmative Live every Sunday morning at 9 a.m. Pacific Coast time. Okay, so today we're going to be talking about maskless. Oh my God. So on Thursday, we got the good news from the CDC, Centers for Disease Control, and you can always go to their website, cdc.gov, and read their latest recommendations regarding the pandemic. That people that are fully immunized do not have to wear masks indoors, as well as they do not have to wear masks outdoors. And I was surprised by all of this. And I'm like, oh my God, what's going on? You know, where's all this data coming from and so forth? And how do I manage it and handle it for my family here in Palm Springs and my friends and my workplace as well? So I'm going to give you some information about the new guidelines, and I'm going to give you some recommendations and some common facts about the disease. So we've been covering the COVID-19 pandemic in the United States since the beginning of March of last year. And as it stands today, May 16, 2021, there have been 32.9 million cases of COVID-19 documented. And there have been over 585,000 deaths associated with COVID-19. So this has been a devastating pandemic in the United States and throughout the world. Now there is some good news in the sense we've learned a lot about the virus. We've learned a lot about the transmission. We've learned a lot about the new vaccines that have been developed in a very short time. Usually it takes now about 2 to 3 years to develop a new vaccine. And we were able to develop not just one, not just two, but in the United States, we have 3 COVID-19 vaccines approved for national emergency use to prevent COVID-19 disease. Those are available now, and we have adequate supply. So if you have not get vaccinated, you still need to get vaccinated as soon as possible. And all you have to do is text your zip code to GetVax, one word, GETVAX. Text your zip code to GetVax, and it will give you at least three sites where you can get vaccinated for COVID-19. And a lot of pharmacies and clinics now are taking walk-in appointments. So it's readily available. There's no reason not to. All vaccines are extremely safe. And we know that not only from the clinical trials, but now we also know that from the worldwide evidence that we have that shows the more people that are vaccinated, slowly we're starting to see the decreasing in cases and the decreasing in deaths. All good news. So not only are these vaccines safe and effective in clinical trials, but they're effective in the real world and they're safe. So remember, the side effects are minimal, and there is associated, so we have 3 of them, the Moderna, the Pfizer, and the J&J vaccine. The J&J vaccine has a very low, rare cases reported of blood clots. Other than that, we're talking about pain in your arm from the shot. We're talking about rash, possibly, maybe some fatigue, maybe a fever, but overall, it's very well tolerated. There is a minor, and again, very low incidence of a possible anaphylactic reaction. So if you've had reactions to medications, particularly IV medications, severe reactions, definitely talk to the healthcare professionals that are providing you the vaccine so they can be prepared to monitor you for 15 to 30 minutes after you receive the vaccine. In the real world, that has really not been a problem. Anaphylactic reactions have really not been a problem. It's only that latest new signal, and we have a vaccine monitoring system for safety in the United States. All adverse events that are associated with vaccines are reported to the government and are analyzed for safety signals. The only new signal that we have reported on has been this very rare incidence of blood clots with the J&J vaccine. These vaccines are extremely safe, and they're very effective at preventing COVID-19, and they're very effective at preventing hospitalization as well as deaths. So get vaccinated. Text your zip code to get vax. Hi, Denise and Helen out there, and Jimmy and friends out there. We're coming to you live from Palm Springs, California. Now, I want to report to you how many people have been vaccinated in the country. As of yesterday, 15.6 million people have received one dose of vaccine. That's 47.6%. And as far as two doses, over 121.7 million people have received two doses. That's 37.1% that are immunized. Fully immunized means that you're 2 weeks beyond your last shot. So your immune system has had enough time to generate antibodies towards the spike protein that's located on the surface of this COVID-19 virus. So we still have a large percentage of people in the United States that have not been vaccinated. So get vaccinated, because we do want to still achieve that goal of getting approximately 75% immunized, whether that's immunized naturally because they've already been exposed to the COVID-19 and they have antibodies, or whether they're vaccinated with one of the 3 vaccines we just summarized for you, Moderna, Pfizer, and J&J. Get vaccinated. Even people that have had COVID-19 disease need to get vaccinated. And the reason is there are mutations that are emerging, so you need to have protection from these highly contagious mutant strains of the virus, which may be more virulent, that is more causing of severe disease. Okay, and the second is we don't know right now how long your immunity lasts if you've had COVID-19 disease. Get vaccinated. There's no reason not to get vaccinated. Don't be stubborn about it. Get vaccinated. Go to Get Vax, text your zip code to Get Vax, and get vaccinated as soon as you can. There's no reason not to. It will prevent sickness. It will prevent you from getting moderate to severe disease. It will prevent you from being hospitalized, prevent you from death. But not only do it for yourself, do it for your loved ones, do it for your family, do it for your community, because it decreases the spread of disease. So let's talk a little bit about herd immunity. We've had prior episodes where we've talked about when 75%, 70% or higher is no magic number. The majority of the people in the country are immunized. That decreases the burden of disease in the population. And we are actually become like physical barriers because we can't spread the disease. We're immunized, or we have natural immunity against the disease. We're immunized, we can't easily spread the disease, so there's no place for the virus to go. That's the concept of herd immunity. It's a gradient. Okay, as more and more people get vaccinated in the United States and throughout the world, right, we're starting to approach that concept of herd immunity, right? And we're seeing it now. We're seeing it now in the decreasing numbers of cases and deaths, okay? So it's a gradient. And as we get more and more people vaccinated, we're reaching more and more herd immunity. And there is a time clock ticking. We want to get this virus eradicated. That's the ultimate goal, not only in the United States, but eradicate throughout the country and throughout the world, because we don't want the current virus to mutate further. We already know it has that potential. It's already mutated. There's already several variants identified which are more highly contagious. We want to eradicate the disease like we've eradicated polio. We want to eradicate the disease and prevent the disease from spreading to decrease the likelihood of these mutations. That's the goal. Now, just remember that herd immunity is a gradient. As more and more people get immunized from COVID-19, the number of cases and the number of deaths are going to decrease, and that's what we're seeing. I'm here to report to you that in California, just looking at my notes now, we have a very low case rate of disease and a very low death rate of disease in the state of California. At one point in time, we were one of the epicenters of disease in the Los Angeles area, but now I'm happy to report that it's actually quite low. So it brings up an important point. Through the internet, you can look up your state, your city, your county, and look at the number of cases and the number of deaths on average that are reported. Generally, they may report this as the average for the past 7 days. Okay, so not every county and state and city has the virus as much under control. Okay, so for me, in Palm Springs and the Coachella Valley, the number of cases are practically zero. And so because I'm now fully immunized as well, my risk is extremely very low. It's practically zero from getting the disease. However, if I travel to another state or to another country that has a higher case rate and a higher death rate and perhaps different variants of the virus, that risk will elevate. So when you're traveling, you really need to find out what the guidelines are for people traveling, okay, with regards to precautions, whether you're allowed to travel into the country or not, and how to use the masks. So we're now maskless in the United States for those people that are fully humanized. Both indoors and outdoors, people that are 2 weeks out from their last shot do not have to wear a mask. There are exceptions. Planes, trains, buses, subways, you still have to wear a mask. Then there are local, city, and state ordinances that you need to check with regards to wearing a mask indoors of a business. So in Palm Springs, which is in Riverside County, in the state of California, in Palm Springs, when you go into a local store, you're still required to wear a mask. They are reevaluating the guidance and the regulation as we move forward in time, and approximately in the next few weeks, we'll know whether or not we don't have to wear a mask indoors. So, as much as I want to say we're free of masks, I'm always going to carry a mask in my automobile, in my briefcase, in my pocket, just in case I need it when I'm visiting a local merchant and a local store for quite a while. And use your common sense. When you're at a large crowded event, whether it's indoors or outdoors, you need to wear a mask, okay? So it's not that we're completely maskless, it's just that we don't have to wear a mask as much. And you really need to be familiar with your local city and county state regulations with regards to the CDC recommendations. Now let's talk about kids. That's a question that I just received from Tony in Florida. The good news here is that children that are 12 years of age or older can now receive the Pfizer vaccine. So I'm here to tell you, get your kids vaccinated. It's safe and it's effective, so you want to get them vaccinated as well. And once they're fully humanized, they will follow the same guidance that adults do with regards to wearing masks. You don't have to wear them outdoors. You don't have to wear them indoors. However, there are exceptions when we're talking about public businesses. All right, so you need to know, again, your city and county guidance with regards to wearing masks inside a business. But if you're in your home, you don't have to wear a mask. Get your kids vaccinated. That's really good news. Now, the kids that are less than 12 years of age, they are developing a pediatric vaccine, and hopefully by the fall, by the end of the year, we'll have the answers of whether there's a safe and effective vaccine for children. But right now, between the ages of 2 and 12, kids need to wear a mask. Okay, so when they go back to school, or if they're in school now, they need to wear a mask. And you need to show them how to wear the mask properly, and you need to keep telling them to wash their hands and use hand sanitizer and practice social distancing, because they're unvaccinated and they're vulnerable to the virus. So, to the contrary, anyone can get COVID-19, all right? It's just the amount of risk that you or a loved one might have. And that risk depends upon your age, and it depends upon comorbidity, whether you're immunocompromised or not, whether you have cancer or not. I would highly recommend that an immunocompromised person, such as a person with an autoimmune disorder or a person that's receiving chemotherapy, radiation, or has cancer, other types of immunocompromised patients as well, have that discussion with your physician. What should I do with regards to wearing masks indoors? Okay, and it depends upon how your own immune system and its ability to be able to fight a viral infection. So there are exceptions, and there are different levels of risks depending upon where you fall in that spectrum of comorbidities, people with heart disease, lung disease, obesity, diabetic patients, cardiovascular disease. These patients have a higher risk with regards to COVID-19. And again, be smart, get the information directly from your physician. Just call up the office and ask to speak to your physician or your clinician, and ask for guidance with regards to mask wearing. But right now, if you're fully immunized, you basically don't have to wear a mask outside or inside. But again, it depends upon the guidance at your local city and counties with regards to wearing masks in businesses. And it's confusing. Some businesses are now saying you don't have to wear a mask, okay? But again, ultimately, the public health state officials will determine that in your city and your state, not necessarily the particular business chain that may make a statement or a policy. Basically, you have to follow the most strict policies that apply to you wherever you're located. All right. So again, I just want to summarize again, when you're traveling, whether you're traveling across state lines or whether you're traveling out of the country, check to see what the guidance is for where you're traveling to. And you certainly, if you want to take a vacation this year, taking an outside beach vacation seems to me like the best and safest way to go right now. And check to see what the hotel restrictions are with regards to mask wearing, and what services they're providing. A lot of hotels still are not fully opened and are not providing full services. So don't spend a lot of money on a fancy hotel if it's not going to provide to you room service, right? And a lot of businesses are still just starting to open up, and they're hiring people, and it takes time for them to ramp up from when they were closed. Okay, I know it's really kind of sort of confusing, but I'll allow this video to be on Facebook, and then it'll be on our Pharmative YouTube for replay back. But the bottom line is, inside businesses, we need to check with what the store's policy is and what the city and county guidance is with regards to wearing masks inside a business. Okay, we are now on the honor system. So those people that are not vaccinated, we don't know the difference between a person who's vaccinated and a person that's not vaccinated, right? So we're on the honor system, and you know if you've been vaccinated or not. There doesn't seem like there's going to be any kind of a vaccine passport, at least not anytime soon. So we're on the honor system, and those people that are not vaccinated need to get vaccinated, okay? Highly recommended by the CDC. Get vaccinated. It's stupid not to. I have heard every excuse. I don't have time. It doesn't take a lot of time now because they accept walk-in appointments. Doesn't take any time. I don't get sick. Okay, well, the older you get, the more likely you are to get sick. And if you have comorbidities, this is a highly dangerous virus with a high mortality rate associated with it. Why are you taking chances with your health, right? This is Pharmative. We always say, stay healthy, as it's easier to prevent disease than to treat disease. You don't want to get this virus. I've talked to several people who have had the virus, and we're talking about being sick for 7 to 10 days. We're talking about serious illness, fatigue, confusion, fever, chills, not able to eat, GI symptoms, okay? And even once they've recovered from it, they have alterations in their sense of smell, taste. They may have confusion, so it affects their mental status, and they may have chronic fatigue. And then there are long-term complications associated with COVID-19 disease: lung scarring, heart disease, clotting disorders, neurologic toxicity, which we've discussed before, and unknown long-term risks. Don't take the chance because you're feeling okay now. I don't need to get vaccinated. Oh, we're clearing the pandemic. What's true today may not be true 6 months from now. May not be true during the winter, okay, as we approach flu season. Get vaccinated today. We have plenty of supply of vaccine. There's no reason not to. It's free, okay? It's stupid. I'm telling you something. It's stupid. All of the excuses I've heard so far why they're not vaccinated are stupid. It's really stupid not to be vaccinated. And it's really inconsiderate because you can spread the disease to other people in your community and to other people in your family and to other people in your neighborhood. It's really inconsiderate not to get vaccinated. So get vaccinated. Okay. All right. So I am just looking at my notes. We're almost at the end of 15 minutes. Our goal is still to get 75% of the population fully immunized. That'll minimize the burden of disease. We've talked about children, and I have one last thought to tell you about. If you do think you have COVID-19, you want to self-quarantine, you want to get tested for COVID-19, you want to call your doctor, you want to monitor your vital signs, you can buy a pulse oximeter. If your clinic doesn't allow you to have a pulse oximeter, it's the most sensitive way to measure oxygen levels in your blood. You can buy one on Amazon or online for $35 to $40. It should be above 95% saturation of oxygen. You need oxygen to live. We know that this is not a systemic disease, but it also affects the lungs, your ability to oxygenate your blood. If your oxygenation level falls dramatically, falls below 95 or significantly from baseline, you need to call your doctor immediately, see if you need to be hospitalized for oxygen support, and you need to ask about monoclonal antibodies. So monoclonal antibodies are available, and they're available for free at various outpatient infusion centers throughout the country. You need to ask if you are a candidate for monoclonal antibodies, which target the virus immediately by a 90-minute, I think it's a 60 to 90-minute IV infusion, and it's these monoclonal antibodies specifically target the spike protein on the virus, can crush the virus. Our ex-President Trump received the cocktail, it's often referred to as the cocktail, and recovered and was discharged from the hospital in 6 days. Chris Christie also had COVID-19 disease, received the cocktail, was released very quickly from the hospital. It's very safe and effective to receive these monoclonal antibodies, but you need to ask. Ask for an infectious disease specialist and ask if you're a candidate for monoclonal antibodies. So that is it for today. I am going to still carry my mask with me because there are some advantages. I haven't had a cold in over a year. I haven't had the flu this year. There are other contagious illnesses, and I don't mind wearing a mask, especially to be considerate to other people as well. But when I don't have to wear a mask, now that I'm fully immunized, I won't wear a mask. But I will find out if my local business will allow me to come into the store without a mask. That's it for today. This is Pharmative Live. I'm Dr. James Partyka. I'll see you next week at 9 a.m. Pacific Coast Time. And as I always end off every call, stay healthy. It's easier to prevent disease than to treat disease, believe me. I've treated a lot of sick patients over the years, and I work in cancer research now. You want to prevent disease. That's the best thing that you can do. So you want to make sure you get your vaccinations on the schedule. I just got my shingles vaccine, the first dose. And then on my notepad, I keep track of a healthcare journal where I have basic information about myself, my insurance card. I take a photo of my insurance card. I take a photo of my driver's license. I have my current medical history, my current medications, any drug allergies. I don't have drug allergies, so I put no known drug allergies. And then now I have my vaccination history. All of that is there for you in your online healthcare journal on my notepad. I suggest you do the same as well. Thank you, and we'll see you next week.